in 2023 and identified 46 recommendations about how we should approach this legislative task. Both of those undertook significant consultation, both with stakeholders, with industry and with the community, to make sure that we got the settings for this legislation right. So we know that there's great demand for assisted reproductive technology in Australia. About 5% of Australians use this technology, and in Western Australia, 6,000 women have used IVF annually. Demand for services has grown, but our laws haven't kept pace, and so this legislation addresses that. The fact we haven't had the appropriate legislative framework has meant that many people have been required to travel overseas or interstate if they want to access IVF treatment or surrogacy. So this bill, as I said, is about improving access to healthcare for everyday Western Australians. It'll do that by removing the requirement to demonstrate medical infertility for people to be able to have access to these services. It'll not just mean better access for couples, but it will also provide access for same-sex couples, for transgender and intersex people, and single people as well. Importantly, it gives a central role to clinicians in making the decision about who can access these services, and as the Premier has already outlined, this brings our laws broadly in line with those that exist in the majority of other Australian states. These laws will also be better for children who are born from surrogacy or assisted reproductive technology. Central to the consideration in this bill is the welfare of the child, and it will also ensure that children are able to have access to information about their genetic heritage. We're also establishing a modern regulatory framework. It'll mean that safety and quality of care is paramount to decision making. There'll be a key role for the Department of Health in ensuring that facilities are going about their work appropriately and that we have a licensing framework to see the work that they're doing. I'm really excited about this legislation. It is providing additional access to people who need it. It means people will no longer have to travel overseas and interstate to be able to get access to the healthcare that they need. I know that my children have been one of the greatest joys in my life, and I'm very excited about this bill, which will ensure that more West Australians are also able to access care to make sure that they can have children that will bring joy to their lives as well. And with that, I'm really happy to introduce Paul Hadfield to talk about his experiences.
Hi, good afternoon everybody. So I'm going to read, so please forgive me. So my name is Paul Hadfield-Gia. I'm the proud father of two wonderful children. I have a daughter who is 4 years of age and a son who has just turned 10 months old. My children were both born through international surrogacy agreements because our current laws discriminate against people like me. Being a gay man meant that the only way that I could have children was to go overseas. It's not only costly, but it's also risky for everybody involved. But people still continue to take these risks because there have been no other options. I consider myself one of the lucky ones, as my husband and I have had the best experience with both our surrogate and our egg donor in the USA. Both approached us to do a sibling journey, and they are both very much part of our extended family. I am eternally grateful to Deanna and Mariah and their families. I currently sit on the board of Rainbow Families Australia, and I co-run the community group Gay Dads WA. We've been advocating for these reforms for quite some time, alongside other groups and individuals. There are currently hundreds of Australians that have gone overseas to have their children, and there are currently hundreds still waiting for the Western Australian laws to change. WA is the only state where our ART and surrogacy laws violate our equality laws. These laws exclude and discriminate many LGBTQIA+ people from starting a family. But it doesn't stop there. Our current laws actively punish many of those families that were forced to go overseas by not permitting parentage rights, leaving our children with lesser protections than other Australian children. In 2021, I had a cancer scare. I suddenly realised that if I died, then my baby girl could end up in the system. Even though my husband has loved and cared for her since she was born, the law does not allow him to be recognised legally as a parent. Our laws do not only discriminate, they also are barbaric and they are cruel. We've been working with the Cook government for some time now, sharing our stories so that the reforms in WA can meet the standards set across the rest of the country. These reforms will enable easier access for all Western Australians. It will enable protections for all people involved and put the best interests of the child first. It will also enable those children born through previous surrogacy agreements to have both parents recognised in the eyes of the law. This is truly a monumental, This is truly monumental legislation. It's about allowing Western Australians to create their families here safely in WA. We welcome this legislation with open arms, and we thank the Cook government for delivering them here, these reforms. But it's not done. We now ask our MPs to connect with people with lived experience and understand the challenges that we have faced and that many more people are facing. As a proud Western Australian and as a proud parent, I ask our MPs to support and vote for a Western Australian law that helps create children and loving families safely here in WA. Thank you.
Hi everyone, I'm Candice Dix. I'm joined by my husband Christopher Dix, and we are proud parents of 4 beautiful children. We've got Beau, Arlo, our sons that I was able to carry, and unfortunately due to medical complications with my second birth I couldn't carry again, and so we've had our beautiful daughters Starla and Odessa through surrogacy. And I just want to start by building on what Paul has said. We're absolutely thrilled to be here for this announcement. Today is a massive step forward for West Australian families having children and their families through different ways. We had our 2 beautiful girls, as I mentioned, through surrogacy in Ukraine, and we had to go all the way to Ukraine to make that happen. And I'd love to see a day where West Australians can do that here, at home, in our state. We'd like to thank the Premier and the Cook government. The Premier made us a promise, and I'm so glad to see that today we know that he meant it. And when the time comes to vote for this, I encourage members of Parliament to think of every Western Australian and support these critical law reforms. For us personally, we want to make sure that our daughters born through surrogacy have the same rights and protections as our sons.
Questions? Yes. We went to Ukraine again, which is an avenue that's really shut now as well.
Yes.
So how important is it to safety of being able to do this more?
It is so much more important. When we were looking into surrogacy only a few years ago, our daughters are 5 now, the landscape is constantly changing, and certainly, as you say, it's such a different situation in Ukraine at the moment. So it's absolutely critical that we have this avenue available to Western Australians here at home in Western Australia.
Any questions for Paul? You just one for Paul. You mentioned that it's not done yet. What's your message to other MPs in the upper house without a Labor majority? Are you concerned about the way there and the tone that debate will take?
Yeah, I'm obviously very concerned. Look, it's so wrong that Western Australians are forced to go overseas to have children. It's so risky and it's so dangerous. We really need our MPs to stand up and to work together to realise that this is about creating families here in Western Australia. I mean safety. A lot of people talk about the risks involved. Let's do it here in WA and make it safe for everybody.
Thank you very much, guys. Any questions or issues of the day?
So in 2019, Sonia Allen, you made very similar recommendations regarding this to South Australia.
Yep.
They were able to get their house in order and get changes made quickly. Why couldn't WA do the same?
Yeah, so you're right. We had Sonia Allen after the South Australian review come and provide us with advice in relation to how we should change our laws. You remember in the early days, I brought changes to the Surrogacy Act, which was to overcome some of the initial obstacles that we identified, particularly in relation to discrimination against same-sex couples. What we've done now is actually combined three pieces of legislation: the Assisted Reproductive Technology Act, the Surrogacy Act, and the Artificial Conception Act into a consolidated piece of legislation. It's very complex. You have to understand that we have to combine the aspirations and the experiences of people everywhere, a wide range of experiences, and understand and take account of the ethical issues associated with this. So I'm very proud that we've got this far. Unfortunately, it has taken a long time.
You had a very large majority last term. Why wasn't it a priority to push through that legislation?
Well, this was being worked on by Minister Abhijit Sanderson. We undertook this work as fast as we could, but with care. We wanted to make sure the legislation was right, and this is part of the conversations that we had as part of our targeted consultation, as part of the conversations I had with the representatives and advocates behind me. It's about making sure you get it right. So we took time and we undertook the process to work with the community to make sure we get it right. So hopefully we've done a good job. You'll see the Act. It's a substantial document and it's a very complex piece of legislation, and I'm very proud to have got to this point.
Is it a priority now? And further to that, are you concerned about any potential filibustering from House MPs?
Well, look, this will be a conscience vote in the House. We usually apply the conscience vote in relation to these sort of matters. So it's a matter for every individual member of Parliament to take responsibility for their actions. As Paul and Candice have just said, we want every MP to really focus on this legislation and make sure they understand it, but make sure they don't unnecessarily delay. They've waited long enough.
Sorry.
Yep.
Does this change who can be a surrogate and how? Does it open the door for paid surrogacy arrangements?
Now, let me be really clear. This does not open the door to paid surrogacy. It's only for surrogacy arrangements that are made as a result of a mutual relationship between the donor and the recipients. It allows for certain costs to be allayed in relation to the case of the surrogate, but not a paid arrangement.
Yeah, the opposition says this legislation has been introduced today to distract from the hospital system that's literally falling apart. Is it?
That's a disgraceful accusation to make. This legislation has been put together very carefully over a long period of time in consultation with advocates and community groups. We've worked tirelessly to bring this legislation to bear. And this isn't about the government. This isn't about the opposition. This is about the people standing behind me. This is about providing the opportunity for people from right across our community to have the joy of having a child, of having a family. To say that this is a political exercise is quite frankly embarrassing and a disgrace.
Is the hospital system falling apart though?
Our hospital system is performing extremely well on behalf of Western Australians. We have some hospitals which are older than others. In particular, Sir Charles Gardner Hospital, which is one of our heritage hospitals, is older infrastructure. It welcomes over 500,000 patients a year and is a very large and complex piece of infrastructure. So obviously you need to continue to make sure you undertake the maintenance to ensure that it can provide quality health care. And it does. We know our hospitals continue to provide world-class health care through thick and thin, through rain, hail and shine. You know, they continue to perform extremely well. And in the case of Sir Charles Gardner Hospital, you know, even throughout the reports of maintenance which has been undertaken that have been highlighted in the media today, no procedures, no operations have been delayed or cancelled as a result of that work.
No apology then, I suppose it's evidence would suggest that we need to do.
Well, what the leader of the opposition did today was disgraceful. What he did was scare Western Australians on behalf of his own political hide, for his own rank political advantage. He scared Western Australians and undermined their confidence in their healthcare. So people today must be, if they're listening to Basil Zempilas, and perish the thought if they are saying, is it safe to go to hospital? What an outrageous accusation to make, and what an outrageous slur on the work of the doctors, the nurses and all the support staff that go to make our great hospital system. We know our hospitals provide world-class healthcare. It's time the opposition grew up, had some maturity of leadership and stopped trying to scare the people of Western Australia.
Isn't it the sight of mould on the ceiling that's scaring people more than What's he saying?
When people go to a hospital in Western Australia, they know that they are receiving some of the best healthcare that can be provided, certainly in Australia, and by world standards, the very best.
But that job's made harder, isn't it, by hundreds of repairs that are being done very slowly according to those maintenance laws?
We know that with older infrastructure, it requires more work to make sure that it continues to function and provide great health care.
Why then
And
did the
that is the
maintenance
great
budget
work.
get cut?
That is the work which our hospital staff are providing every day of the week. We look at Sir Charles Gardner Hospital, it's a great example. Almost $70 million worth of investment to renew the ED in that area, to upgrade and expand the ICU. This is work that has to continue all the time.
But the maintenance budget has been cut for North Metro Health.
Well, I hear that accusation, but I also hear the teams there who are advising us that they are undertaking all the work that is necessary to make sure that we can provide great healthcare at that hospital.
A nurse this morning on radio said it out today.
Sorry?
This coral bleaching report out today that last year there was the worst coral bleaching event in Australia's history on WA's
Yeah.
coast. Now the experts say that to help coral reefs survive, climate change has been the main contributor to that, and that we need to reduce greenhouse gas emissions. How do we do that when not much of the project's been approved and it seems like you've got the accelerator for gas?
Well, let me be clear. We accept that climate change represents a risk to our environment, represents a risk to humanity, which is the reason why we are doing everything we can to contribute towards the global efforts to lower carbon emissions. But carbon emissions don't stop at the Western Australian border. They are global emissions, and that's why we have to be part of a global effort to reduce emissions. That includes our gas substituting coal-fired power stations and making sure that we can be part of a global effort to reduce emissions. Now, the Department of Biodiversity and Community Attractions is working with the scientific community to understand this particular coral bleaching outbreak and to work with the scientific community to do everything we can to mitigate against it. But climate change is real. It's another example of why we need to continue to do everything we can to decarbonise our economy.
Yeah, they just spent for the first $217 million on bringing Sir Charles Gardner Hospital up to scratch.
Look, if these complex systems could be you could eliminate all their problems by writing a cheque, we would have done it yesterday.
If it helped,
It's not that
$217 million would help
it's
fix it
not
up.
that simple. This is a complex piece of health infrastructure. It requires ongoing work, particularly in the context of it being aging infrastructure, which is the reason why we put so much work into it. So between June 2023 and January 23 and June 25, over 500 work orders were completed to make sure we continue to ensure that that particular piece of health infrastructure is up to standard. And we continue to work hard in our health system to ensure we provide great health care. That's the reason why we have the lowest, that's the reason why we have the best ambulance response rates in the country. That's the reason why we are the top performing state when it comes to the 4-hour rule in our EDs. That's the reason why we are achieving record levels of elective surgery. So in 1 week in June, over 4,500 elective surgeries were undertaken. That was a record. But not only was it a record, it was the 4th record inside 7 months. So we are doing more every day as part of our health system. Doesn't mean it's not under pressure. We've got a growing population, we've got an ageing population. We've had a particularly tough flu season. But our health system and the doctors and nurses behind it are doing everything they can to meet that demand.
You mentioned
The work orders, the 500 work orders, but are they not to put out the spotlights and fix the major gaping issues, and they're not progressive works to improve outcomes?
Well, that's why I provided you with the detail of the upgrades of the ED at Sir Charles Gardner Hospital and the ICU at Sir Charles Gardner Hospital. So major works which is about modernising specific areas. Other areas we continue to do work to ensure that we undertake that maintenance. And that maintenance is being undertaken, but they're older buildings, it's a very complex piece of health infrastructure, and that's why we continue to work hard to ensure that it provides great health care.
Minister, can we get 2 more minutes?
With the surrogacy legislation,
Just
with the surrogacy legislation, what reassurances can you give to LGBTI community and their families that the debate in Parliament will be respectful to them and their families?
I call on every member of Parliament, if they are cross-examining the bill in relation to this, to do so in a respectful manner. And as I said, this is not about the government. This is not about the opposition. This is not about politics. This is about providing people with the opportunity to have the joy of having a family, a child, and we want to provide that opportunity for everyone. Today's laws are historic for Western Australia. Brings us into line with other states and makes great progress to provide that opportunity for Western Australian families.
Minister,
Yes. Yeah, we'll be raising a range of issues with Chevron in our discussions, and we welcome the work and the investment that they provide and the opportunities, the work opportunities they provide for Western Australians. But all our corporates have a responsibility to be good corporate citizens, and that includes making sure they create local WA jobs, they help to look after the environment, and they continue to make sure they do everything they can to assist the community and our economy. Chevron are no different, but they've done some amazing work in Western Australia. I enjoy working with them, and I will continue to have those conversations. Well, one of the things that we do, particularly under our Jobs Act, is make sure that we generate as many Western Australian jobs as possible. And that includes corporate Western Australia to ensure that when they have opportunities to employ people, when they have opportunities to contract work, when they have opportunities to organise projects, that as much of that work as possible takes place in Western Australia. And of course, we want to make sure that offshore gas fields are worked for the benefit of Western Australians as well, which is the reason why our domestic gas reservation policy is such an important part of our overall regulatory framework.
Minister, just one question, then 1 minute for cutaways. Sorry, just go to Minister, please. Sorry.
Well, that's all you get.
Prime Minister, have there been exposure to human excrement in ICU at St Charles Gardner?
Well, I think it's important to acknowledge that Sir Charles Gardner Hospital is an older hospital, and there is ongoing maintenance that needs to be conducted for that hospital. But the information that I have is that there's been no surgeries, no procedures that have been impacted as a result of any maintenance issues. And working with Minister Carey, we're working closely to make sure that that remains the case.
So there has been human excrement. Can you answer that question? There has been human excrement leaked in the ICU.
So the information that I have from the department is that the sewage issue wasn't a burst pipe, but there was an incident that involved, I believe it was a toilet having some towels stuffed in it. And so obviously that is something that's not about maintenance, it's about activities that a patient or another person might have undertaken.
A nurse this morning said there are mushrooms growing out of the ceiling in the corridors of St Charles Gardner Hospital. Can you really say that's a world-class hospital system?
Well, what we are doing is putting a lot of money into not just Sir Charles Gardner Hospital in terms of upgrades, we've also got ongoing programs to manage issues that come up. So as the Premier's outlined, we have committed $50 million to upgrade the emergency department. That work's taking place now. Another $25 million to expand the intensive care units. That work is also underway. So we are providing important upgrades to Sir Charles Gardner Hospital, as well as dealing with ongoing maintenance issues as and when we have to. Thanks very much.
Just one.
About surrogacy. I know I had those questions for surrogacy. Stop it. Oh, I guess we'll go to that. Okay. The next one's 1 to 1:30. So yes.